Hey folks, I'm Scott Raffa. I'm a neurosurgeon here with the Cantor Spine Center, and beside me we have Anthony Giuffrida.
Yeah, so I'm Dr. Anthony Giuffrida, PM&R trained, fellowship trained in interventional spine and sports. My background takes me by way of upstate New York, Syracuse, for my medical school. I did my PM&R residency up in Albany, New York, got a little bit further south for fellowship in Birmingham, and then came down here and joined Dr. Cantor's practice in 6.5 years ago now. So it's been a really fun ride and fun to take care of patients together.
My name is Scott Raff. I'm a neurosurgeon. I also am with the Cantor Spine Center. I've been a neurosurgeon for 6 years now, board certified. It's a pretty lengthy process, but you get there step by step. Like Anthony said, it starts with med school, and that was in South Florida, University of South Florida at Tampa. I also did training at the University of Miami and also at Boston University as well. So I'm a neurosurgeon that focuses exclusively on spine surgery for the majority of my training, and then in fellowship training. So far, about 6 years out now, board certified. I've probably done about 3,000 cases and counting, and about 25 to 30 cases a year. So we're doing about maybe 300 in the next 12 months or so. And we have two offices, for me at least, down here in Fort Lauderdale and also in West Palm Beach. But in fact, we have a Jupiter clinic. We have a Boca clinic now.
Yeah, we have four offices, two main hubs kind of, and two satellites. But the satellites are growing to the size of main offices almost, so it's nice to see.
Yep. We have at least two locations to operate, if not three actually. We have Holy Cross in Fort Lauderdale. We have West Boca Medical Center, and we have St. Mary's Medical Center in West Palm Beach, Florida. And then we have actually a couple, Anthony, you can talk about that, a couple ambulatory surgery centers, ASCs, that we're at.
Yeah, we have some USPI centers, one down here in Fort Lauderdale and one up right next to St. Mary's, Palm Beach International. So the outpatient centers are nice because they're same-day surgeries. You go home the same day, don't have to stay overnight. They're more for the minimally invasive, smaller surgeries that a lot of the interventionalists do, the pain docs do. So on the pain side, we have myself, Dr. Chhatlani, and Dr. Westerhouse, and the three of us cover the 4 locations. And then on the surgical side, I mean, all the surgeons we have at Paley, probably around 23 surgeons, but on the spine team.
And counting.
Yeah, and counting. And the spine team, I mean, what do you guys
The spine
now?
team, well, I mean, there's two sides to the spine team, so we can mention that right off the bat. The adult side of the spine service is really what you're here to talk about, the Cantor Spine Center. And we'll go into that and how we have a relationship with the physical medicine and rehab physicians, all board certified physicians. We have the adult folks like myself and also Jeffrey Cantor, who's an orthopedic surgeon down here in Lauderdale. We see a lot of adult patients as well as young adults and maybe some adolescents. And then the wonderful staff, a world-class staff in Palm Beach at the Paley Institute headquarters, which sees about maybe 150 scoliosis and deformity cases, all for kids, newborns all the way up through teenagers, with Dr. David Feldman, Dr. Kavya Sade, who's a board-certified pediatric neurosurgeon, and then Arun Hariharan, who will have introductions coming in soon, actually, which would be a great idea to put into the mix. So really a lot of coverage across the entire South Florida area. But really, beyond the intro, we wanted to get to everyone today in this video to introduce ourselves, number one, and get to meet at least 2 of the guys today, and we'll have more coming, but also explain a little bit about how these groups of people work together. So one of the relationships is going to be between physical medicine and rehab physicians, these spine specialists that take care of patients in different ways, and then the surgeons, and how a surgical team actually gets help, a lot of help actually, by these folks and vice versa.
Yeah, I think that's extremely important. I mean, we teach all over the world, and we always see some surgeons that don't work with pain docs, and we see pain docs that don't work with surgeons. And I always say, if that's the case, then the pain docs are probably over-treating, treating patients that might need surgery, and the surgeons might be quicker to go to surgery without having a pain colleague that can help out. So what we have is the same docs in the same office, to the point where you can sometimes see both of us in the same day. You might be seeing me in the office, and I see, your cervical MRI, and you have severe stenosis, and I might be able to bring right in Dr. Jeff Cantor or Dr. Scott Raffa here right in to take a look at it. And we can really get you queued up for what could be if you're at a big system, it could take you weeks to get in to see the neurosurgeon, and then the pain doc probably didn't even talk to the neurosurgeon. And this is something that you might need to have fixed pretty emergently. So we're able to do it right here within minutes, and it really does well for the patient. The patient knows the handoff was done cleanly. The patient knows that we've spoke directly. We usually speak directly in front of the patient. And I've worked a lot of places, and I haven't had this kind of team before. It's really amazing.
So I'll mention what I do from the field of neurosurgery. We'll talk about that just for a minute or so, and then Anthony will mention how the physical medicine field covers parts of spine surgery, and then we'll wrap it up and say, hey, how do these things fit together on a day-to-day basis? For example, on how we see a patient and really make things click even instantaneously when you got things that are concerning. You can see someone in 60 seconds or less, get great opinions, and then take care of patients. So neurosurgery is a specific discipline of surgical sciences. It's meant to take care of pathologies or problems of the brain, the spinal cord, and the peripheral nerves, believe it or not. Here we focus specifically on spine pathologies and peripheral nerve problems. It's a discipline that takes about 7 years of training after medical school. You do a lot of ICU and critical care training, and then if you choose so, at least for myself I chose, you can do more specific training to handle spine surgery. So what does spine surgery mean? It really is how to operate and take care of the spine and the spinal canal and all the nervous system that's involved. There's a lot of ways to cover on that, a lot of different techniques and approaches to the spine, but that's what our expertise is for a career, lifelong, is to figure out how to take care of patients and these problems from head to toe, pun intended, and involves very specific training in order to get that understanding and then carry that through a career. Anthony, how do you think that fits in? Well, first, actually, tell me the definition of what physical medicine rehab is as a discipline, and then we can talk about how it connects with each other.
Yeah, in lay terms, physical medicine rehab means we have to take care of the whole body. We know where every nerve goes. We know where every muscle inserts and attaches. It's really a head-to-toe physical that we do when you come here to really figure out what's wrong with you. You might have knee pain, which is causing your back pain. And I could treat your back pain all day, but it doesn't go away if we don't fix the knee. And that's something that physical medicine rehab doctors are extremely well trained at in our 4 years of residency. Then we do 1 year of fellowship. Basically, the year of fellowship teaches us how to do all the procedures we need to do to get rid of that pain. The hard part's diagnosing that pain. And doing a really good physical exam is what is needed. And we pride ourselves here at Cantor Spine Center and the Paley Institute at doing that really good physical exam, asking the right questions, getting the right images to figure out the problem. Because if you just go for treatment and it's not working, it's probably because you have the wrong problem diagnosed. Our job, our main job, and the surgeons say this to you as well, is to keep you away from surgery. We do a really good job of that, but obviously not all pathologies can be fixed with some type of injection or some type of rehab. But our job is to try to get you back to living your life, loving your life. But we are very lucky to have very good surgeons here that are really well-versed at getting you back. And I always say to my patients, I think you'll agree with this, you only want to do surgery once. So you want to do the right surgery. Mm-hmm. You know, if you do a knee injection and it doesn't work, it's not the end of the world. We can still do the hip injection if we think it's the hip. What you don't want to do is, just to keep it apples to apples, what you don't want to do is a knee replacement and then it's really your hip. And in the spine, that's even worse. Because if you do a spine surgery and it really doesn't work for you, it makes things a lot harder later. And it's important to have that good diagnosis and have that great teamwork and handoff with the surgeons in order to get the right procedure done.
Yep. I think that's pretty darn accurate. The best way I would describe how we work together, this is my interpretation, is it's really considered what's discussed as a multidisciplinary field of medicine or a multidisciplinary approach to medicine, which is basically how you get this stuff organized on a day-to-day basis, even how patients come to see us and wait here in the lobby like you may be already doing. The goal is to work together in a stepwise fashion in this multidisciplinary field of spine surgery and spine medicine. So it starts somewhere with primary care physicians, even physical therapists, even an individual's own effort to do behavioral changes and treat their issues with medicines and observe for symptoms. But eventually, you need to walk up this staircase. So we'll have probably a staircase video or a little side note, so you'll see a visual here of how this works in a stepwise fashion. So at some point in time, you see physicians like your primary care doctor or a chiropractor, maybe even eventually a sports medicine physician or so on, or even Anthony and the rest of his team, and you work your way up this ladder. So at the end of the ladder or towards the end is the surgical part if you ever need to get there. And hopefully you can get off this process and be successful in your endeavors and be well. So we keep this thing organized more or less. It's a good start. And then with that said, if you ever had to reach the top or the end of the road, proverbially, then there's still a great plan, and all this downstream relationship has been established. All this conversation, discussion on the diagnosis, all the detective work that has to get done can really confirm and solidify what people are worrying about. That's called the diagnosis, and then really have everyone talk about what this treatment plan is and how we think this best fit model is going to work for patients if it ever really did come down to surgery.
And I think the biggest thing here, and I've worked with other surgeons, is the patient needs to feel comfortable with both the diagnosis, the procedure, and the physician that's performing that procedure. And that's one thing we strive for here. We want you to feel comfortable. The patient is a part of this team that we're talking about. That's, I see patients 2-3 years later, and they come right up to us. They give us a hug. They say, I'm doing great. That's really what we're here for, is to make sure the patient feels like they're a part of the team. They're well-versed in what's about to happen to them, and then they're also well-versed on what the plan is going forward. And I think we do an excellent job of that, and that's something that we really pride ourselves in, is educating and making the patient feel comfortable.
Agreed. I think that's well said, guys. I really appreciate you guys focusing on paying attention on this intro video for now. I mean, there's more to come. We have wonderful staff, lots of intros that we'll discuss and splice in, and you'll see a couple videos on top of some of the specific things that we do. I'd say the last exercise would be to walk someone through the process. What do you think happens when someone makes a phone call and calls the office or gets sent back down here? What's the first couple of steps that happens?
Yeah, I mean, we pride ourselves on answering the phone. That's the number one step. Our front office is trained on answering the phone and making the patient feel comfortable once again there. They will get that patient then into a review chart. So we review the charts. We have a great, he's not retired. He says he's retired. Dr. B, Venezuelan orthopedic surgeon, who is amazing. And he looks at all of our charts before you even come in the office and say, hey, this patient might be better off with Dr. G, might be better off with Dr. Raffa, might be better off with Dr. Cantor. And then we give you a call and say, hey, would you like to make an appointment? This is all very smooth and seamless. You even send in a free MRI review. You could send your MRIs in and we'll look at them beforehand and let you know, hey, we don't think it's surgical. Or, hey, you know what? You are going to need surgery. You're going to need the surgeon right off the bat. Yep. You come in and let's say you see the pain doctor first. That would be, the longer process of going through all those stepwise, but it might avoid having surgery. You'd see myself and one of my nurse practitioners. You'd meet our medical assistants. Everyone's very nice and friendly. You'll learn their names. You'll enjoy being here. That's what I always say to patients. They enjoy coming here. I'll diagnose you. We'll try some treatment options. If that works, great. We'll say, hey, call us when you need us. If that doesn't work, then we'll do a direct handoff to the surgeons. If the surgeons are in the OR, obviously they can't walk in the door right at that minute, but a lot of times they are here and they can directly see you, at least put eyes on you, and then we'll get you a full consultation with them. And they spend ample time with you. This isn't a 5-minute in and out surgeon time, and I'll kind of hand it off to you where you take it from here. But we give that direct handoff to the surgeons, then the surgeons take it from there.
So we've had a lot of ways to get in. The classic one is what Anthony's talking about. You get to some point in time where you say, hey, we really need to talk with the surgeon, any one of them. I mean, this could be for a pediatric case or a patient in Palm Beach County or St. Lucie County or even, international, let alone where we're at in Lauderdale here, to talk to one of us, face to face. And then we start the whole process, not over again, but just a little more in depth with the radiology and what's already been gathered so far, all this, data collection. And then really render an opinion on what's going on. It's not a 5-minute thing or a 10-minute thing. You're with us for 45 minutes to an hour to sit down, get educated, use a couple of models, talk about some analogies, say, hey, this is really the circumstance now. But also, honestly, and equally more important is, if not more important, is what's life going to be like for the next 6 or 12 months? Is this going to be a problem or even hurt you, So we go into all of that, and then we can cycle back and discuss what's next. Maybe it is, more therapies or some educations, but there's this whole toolkit that we're basically bouncing back and forth from the starting of the process, cycling through the clinic, that I think a lot of folks would appreciate and grow to appreciate, knowing that they're getting a lot of attention and a lot of detail. So how about that? Not too bad for a description of a head to toe in a nutshell, huh?
Yeah, I think you'll enjoy your time here. I know no one wants to come see us here, but if you do, it'll be a seamless process. You'll feel like family, and we'll take care of you.
So we'll have a couple more physicians chime in. We'll have a couple more segments here. There may be some visuals on this thing called multidisciplinary spine care and this multidisciplinary approach with all this coexisting of great physicians and colleagues. So I look forward to that, and we'll talk soon. Thanks again.